Give me 1 second, guys, to set up for the show, please. Be right with you. Good afternoon, folks. Now, today's topic B goes over 2 things for seniors. So this is kind of like a double subject show. So shall we get going on today's show? All right. First subject is the hidden dangers lurking in your medicine cabinets. Okay, is a short Kindle guide that warns readers how common medication mistakes can trigger dangerous drug interactions, side effects, and preventable falls or hospitalizations, especially for older adults. The product page frames the book as an actionable prevention-focused resource with real-life scenarios and expert-backed advice. Key claims on the page. Medication management can lead to life-threatening consequences, including falls and hospital stays. Specific risk factors highlighted include dehydration, interactions between antibiotics and other drugs, mental health medications, and blood thinners made more dangerous by certain antibiotics. Warning signs. The book calls out include dizziness and confusion as possible indicators of a serious drug interaction. Okay, folks, the author of the piece that I'm using for presentation is Nidhi Carlillo, FNP-BC, APRN, family nurse practitioner who writes about prevention and health, environment, format, and length. Kindle edition, 33 pages. Publication details. Sky Wallaby Press, published February 15th, 2025. Why the page emphasizes this topic. Okay, hold on. The listing frames the risks as hidden because the dangerous elements are everyday legally prescribed medications kept in household medicine chests or medicine cabinets. The page stresses that these risks are preventable if people learn to recognize risky combinations, monitor warning signs, and adopt fall prevention strategies. Practical takeaways from the page: be alert to combinations, antibiotics, mental health meds, blood thinners, and dehydration are uh, singled out as a dangerous mix. Watch for symptoms. Dizziness or confusion should prompt review of current medications. Use use the book as a checklist. The page positions the guide as a compact scenario based resource offering concrete steps to reduce medication related fall risks. A clear research based explanation of what the page says about accidental falls in older adults. Key findings from the page: falls are among falls are common and serious. More than 1 in 4 older adults in the US report a fall each year, and about 1 in 10 of those falls causes an injury. Deaths and costs are rising. In 2021, over 38,700 older adults died from unintentional falls, and the fall related deaths rate rose 41% from 2012 to 2021. Health spending for non-fatal falls was estimated at $80 billion in 2020, with projections that costs will keep growing. The main causes and risk factors highlighted: physical and sensory decline, poorer vision, slower reflexes, loss of strength and balance, and mobility, increased fall risks. Medical and medication issues, chronic conditions, diabetes, heart disease, nerve or foot problems, cognitive impairment, and medication side effects or interactions are important contributors. Environmental and behavioral factors, unsafe footwear, poor lighting, slippery surfaces, and rushed movements. For example, due to incontinence, raise the odds of falls. Hurrying to the bathroom, folks, for elderly folks. So what you have to do is make sure that your family, if you have a family member that has medications they take for different reasons. If there if the medication is deemed to have fall risks attached, you have to make sure that the person that that your family member is escorted to the bathroom and safely sat down in a chair so they don't have a fall issue. Okay. Let's see. Unsafe footwear, poor lighting, slippery surfaces, and rushed movements. For example, due to incontinence, raise the odds of a fall. Prevention strategies. The page emphasizes exercise that targets strength and balance is one of the most effective interventions. Medication review, vision checks, and home hazard reduction. Grab bars, better lighting, removing tripping hazards are practical, evidence based steps. Clinical screening tools and programs such as the CDC's STEADY framework and International World Falls guidelines help clinicians identify risks and prescribe tailored interventions. Disparities and system challenges. Geographic and demographic variations. Fall rates and death rates vary widely by state and by racial and ethnic groups. Social isolation and access to care affect outcomes. Health system limits. Time pressures in primary care, uneven access to physical therapy, and financial or transportation barriers make it hard for many older adults to get prevention services. Practical takeaways for readers and reporters. Falls are not inevitable. Many falls can be prevented by addressing modifiable risks, by reframing fall prevention as ongoing chronic care work rather than a one-time fix. Actionable steps. Encourage annual fall risks screening for older adults or older patients. Promote strength and balance programs. Review medications and make simple home modifications. Okay, now we're going to get into, for the second half of the show, we're going to get into falls in the elderly. Okay, so here we go. Falls in the elderly. Falls are common, serious, and often preventable health problem for older adults. They cause substantial mobility disability, hospital admissions, and rising health costs. And many falls reoccur unless risk factors are identified and managed. Key factors and prevalence. More than 1/3 of people age 65 and older each year, and recurrent falls are common. Falls related to injury and deaths are increasing, and falls are the leading cause of injury related hospital admissions in older populations. Risk factors and pathopsychology. Falls result from interactions between long-term predisposing factors, age-related gait changes, sensory decline, chronic disease, and short-term precipients, trips, acute illness, adverse drug reactions. Independent risk factors with strong evidence include previous falls, balance impairment, decreased muscle strength, visual impairment, polypharmacy, or psychotic drugs, gait problems, cognitive impairment, postural hypertension, and certain neurologic conditions. Medications and medication review. Medications are a well-established modifiable risk factor. Classes linked to increased fall risk include anti-suppressives, sedatives, hypotropics, antipsychotics, antidepressants, benzodiazepines, and NSAIDs. Each drug should be weighed for benefits versus fall risk. Screening, assessment, and prevention strategies. Screening. Ask older patients about falls in the past year and check gait. Balance. A single fall should lower the threshold for full assessment. Full assessment includes history of falls, medication review, orthostatistic blood pressures, and gait and balance testing, vision and hearing checks, cognitive and mood screening, home and safety evaluation, evidence-based prevention, individualized multi-component interventions work best. Proven single components include home modifications for high risks individuals, exercise programs targeting strength and balance, Tai Chi, physiotherapy, and vitamin D supplementation, which would be 2,700, 800 IU a day. Medication reduction, especially psychotropics, and management of postural hypertension are also important. Practical takeaways. Treat falls as medical events with irreversible causes, not inevitable aging. Proactively ask older patients about falls, review medication and orthostatic vitals. Refer to physical or occupational therapy for strength and balance and home safety interventions. Okay, guys, so those are your shows for today. I will see everybody Monday for shows. Until then, Gator Wellness, take care, folks.